There are a number of lifestyle factors that will influence both egg and sperm quality, which therefore influence the ability of those tissues to create pregnancies. For the purpose of fertility preservation, the typical scenario does not allow for the time, because we're usually dealing with a recent cancer diagnosis, for those lifestyle changes to be enacted. In an infertile couple that is not facing a cancer diagnosis and the procedures are not urgent, there are several lifestyle modifications which people can do to optimize their chance of success. It is well documented that tobacco use, especially in the form of cigarette smoking, is very detrimental, mostly to egg quality. In fact, multiple studies have shown that women who are heavy smokers at the time that they go through an in vitro fertilization cycle have up to a 50% reduction in the live birth rate. So it's a factor very strongly associated with poor outcomes in vitro fertilization. The same holds true for the effect of tobacco on sperm, although it is admittedly a less strong association. It has been shown to primarily affect the shape of the sperm, so to make the sperm abnormal in shape, which can affect the fertilization rate or the ability of those sperm to fertilize eggs. So smoking is something that we counsel all of our patients for a lot of reasons, for their general health, but specifically for their likelihood of having success in fertility treatment. That smoking cessation is really important. The other really important lifestyle factor to modify is people who are overweight or obese. Obesity has a significant effect on pregnancy rates as well, that has been documented multiple times over multiple very well done studies. It appears that women who are of a normal BMI, which is defined as a BMI or body mass index of 18.5 to 25, and those in the overweight category 25 to 30, do about the same in terms of success for fertility treatments. But outside those categories, there are significant reductions in success. So people who are obese or a BMI of over 30, and people who are underweight, actually, a BMI of under 18.5 for the female, does have a significantly less chance of having a baby after procedures like in vitro fertilization. And then finally, I do counsel my patients regarding heavy alcohol use. There are women who are planning pregnancy should not be drinking alcohol because of the risk of fetal alcohol syndrome and negative effects on the baby. But additionally, women and men who are heavy alcohol consumers appear to do less well also in vitro fertilization. So those are the three main lifestyle factors that I counsel couples on. Also, men who use marijuana recreationally have very profound effects on sperm, and actually heavy marijuana users or heavy cannabis users can have no sperm in the ejaculate. That will recover on cessation of marijuana use, but it can take several months. Also, men who use anabolic steroids or any testosterone-containing supplements, weight lifting supplements, bodybuilders, etc., can have the same thing. And fortunately, these are reversible changes, but I do tell couples at the initial visit that it can take several months for sperm to recover from that kind of an insult.